For a long time we've been trying to come up with a pharmacotherapy to treat this very common disorder, but unfortunately despite multiple attempts we have not yet succeeded. But it's an exciting time in the field because we've now not only identified new therapeutic targets, for the reasons why people get their sleep apnea, but this has also unlocked new therapeutic targets including pharmacotherapies. So there's four main causes of sleep apnea: your anatomy, or how collapsible your upper airway is, so from the back of your throat to the back of the nose, as well as three non-anatomical causes. And these include how well the muscles around the throat are able to open the airway during sleep, so a muscle trait. The next one is how easily you sleep, or what we call a arousal threshold. And the third, or the fourth one I should say, is what we call respiratory control or loop gain. Now the latter three, the non-anatomical ones, are quite recent in terms of our knowledge, and these are all novel therapeutic targets. We've now identified these four main reasons of why people get sleep apnea. We've always known that it's an anatomical issue, so people with crowded or narrow airways, whether it be due to obesity or skeletal issues, can be a main driver of sleep apnea. But now we know about these other three causes, about how the muscles respond, and a third of people are not able to activate their muscles during sleep, a third of people with sleep apnea. A third of people also have problems with how easily they wake up, so they're light sleepers if you like, or have what's called a low arousal threshold. And the remaining one is respiratory control. Some people are just too sensitive to carbon dioxide during sleep, and that causes all sorts of problems in terms of cyclical breathing and feeds into sleep apnea. So those latter three non-anatomical causes really have opened new targets for pharmacological therapy for this common disorder. What we're trying to do, unlike the main therapy for sleep apnea, continuous positive airway pressure therapy that opens up the airway, and it really doesn't matter why you get your sleep apnea. If you can tolerate the therapy, that will keep your airway open and stabilize breathing during sleep. The problem is half or more of patients that try that therapy are unable to tolerate it, and others are unwilling to even try it. So what we hope that phenotyping can do, and by phenotyping I mean understanding those specific four causes on a per patient basis. If we knew exactly why each individual was getting their sleep apnea, we could then target individualized therapies based on each of the individual's specific problems. So we've developed quite complex techniques to measure those in the research lab, and now our next challenge is to roll those out into the clinic and simplify them down. And again, we're having some progress in obtaining that goal, which will really be necessary in terms of rolling out targeted or precision medicine for sleep apnea. Based on this new framework and understanding of why people get their sleep apnea, it really is an exciting time for the field. These new potential pharmacotherapies will be a major advance for the field, and we're all very hopeful that this approach will help many patients.